Good evening. Today is May 26, 2024. The time is now 5:32 p.m. This meeting of Georgetown County Council is being called to order. I note that we do have a quorum present, and thank you all for being here this evening. We begin our meeting with our invocation given by Councilor Carolina, and he will lead us in the Pledge of Allegiance.
Almighty and eternal God, we praise and thank you for calling us to serve your people. Give us your anointing and make us a vessel of your grace to touch the lives of your people. Father, use us as a channel of your compassion. Help us to be worthy of your trust that we may be an instrument of peace and hope to all in Georgetown County. Give us courage to be an agent of change, to achieve your dream of transformation. Finally, we ask you to heal our land and restore faith and righteousness in our nation. This we ask in your mighty name of Jesus Christ. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Councilor Carolina. We move down to the approval of our agenda. Is there a motion to approve the meeting agenda as published?
So moved.
It's moved for approval by Councilor Elliott. Is there a second?
Second.
Second by Councilor Carolina. Any discussion? All in favor, please raise your hand. Opposed? Motion carries. Agenda is approved. We'll go down to our special reports and presentations. Tonight, our nonprofit spotlight will be from the Children's Cancer Partners. Please state your name and your presentation, please.
Good evening. My name is Dan Daniel. I'm Director of Advancement for Children's Cancer Partners. It's a pleasure to be here with you this evening. I want to thank our friends at the Bunnell Foundation for helping make this possible.
Would you mind spelling your last name just for the record, please? I didn't get it.
Sure. D-A-N-I-E-L.
Daniel, okay. Thank you.
Your child has cancer. As a parent, it's hard to imagine any more devastating words to hear than that. And yet, this year, about 600 families will hear those words right here in South Carolina. They will join the nearly 9,000 families that currently have a child being treated for cancer, either in active treatment or in remission. Of those 9,000 families, about 9 live here in Georgetown County, which means that this year, 2 to 3 children in this county will be diagnosed with cancer. When that happens, those children are getting that news at one of the 3 pediatric oncology hospitals here in South Carolina. For this county, that's almost certainly going to be MUSC. One of the interesting dynamics about pediatric oncology is that there are very few places in this state where treatment can be received. As adults, we have more than 100 treatment options here in South Carolina. As a child, you have 3. Because of the rural nature of South Carolina and the distance between where people live and those 3 hospitals are located, the children in this state who live in those rural areas are going to have a 3-time greater risk of a missed or late diagnosis, of being undertreated, of having a cancer relapse, of suffering more dramatic after effects, and are 3 times more likely to die. What Children's Cancer Partner is committed to is making sure that the cost of getting to care never prevents a child from getting the care they need. For all of its woes, our health system and our health insurance system does a pretty good job of covering the cost of the medical care. What is not covered well is the cost of getting to that care. For many residents in South Carolina, the trip to the cancer treatment facility is a 2 or 3 hour drive each way. The cost of buying gasoline, the cost of staying in a hotel while your child's in the hospital, the cost of meals while you're going back and forth are all things that fall outside of traditional insurance. That's where Children's Cancer Partners steps in. We receive referrals from MUSC and the other 3 other hospitals in the state, and within 24 hours, we are meeting with that family face to face. We're helping them figure out what is their plan for getting to and from treatment. And we will reimburse them the cost of that within 24 hours of them submitting an expense to us. I thought you might be better informed by listening to one of the families that we're supporting.
She was a blessing because I didn't think I could have any more kids. Kept crossing. So I took her to the doctor. They looked at her and they said they seen tumors and they came back cancerous in both eyes. She's legally blind in the left eye.
When Mia's treatment stopped working locally, her doctor had a solution, but it wouldn't be easy.
He was like, I know this guy in New York. I think I can get you up there. Within 2 days, I had to fly all the way to New York with no money. From then on, went every month.
Monthly trips, dozens of flights, hundreds of miles every single time, all while trying to hold down a job.
I said, Children's Cancer Partners came through and helped me out because I had nothing.
But the hardest part for Erica,
When you feel like you can't help your child, that's the worst thing for her. But things, it worked out.
today the Nixons can celebrate some great news. But like many cancer survivors, Mia still has battles.
She's cancer free, but they have to check her because with the tissue, they're not going to be able to see the cancer come back. So she still has to see the doctor for the rest of her life.
Still, Erica knows Children's Cancer Partners will always be there for both of them.
If it won't be for y'all, I wouldn't know where we'd be. Anything I need, y'all one phone call away. And I will tell anybody, y'all have a good system. And I'm very appreciative of everything you do.
And she hopes others will help too.
There's real families out here that really need the help. More people to get involved and understand what we're going through.
Meanwhile, Mia's got her own dreams to accomplish, becoming a pediatrician.
I get to help people.
A blessing for the future, a blessing for her mom, always.
God has the last say so. And I'm thankful that she's here. She's a blessing. Mine.
You heard in that video, for many, many children, the treatment of their cancer ends up having effects that will last them for years, maybe even for a lifetime. When a child gets referred to Children's Cancer Partner, our commitment is to stay with that child through their 21st year. So that even if they're having expenses or having to travel for follow-up care or care that may be incidental to their original cancer diagnosis, we're going to continue to work with that family to make sure that the cost of getting to and from that treatment, no matter where it is, no matter how long it lasts, the family will have the resources they need to make sure their child is getting that care. This gives you an idea of sort of the distribution of ages of children we're currently supporting. Most children come to us at age 7, but it can be as little as a month old, all the way up to something 18th year. As long as that original diagnosis happens before their 19th birthday, we will support them and do that through their 21st year. It's a pleasure to be here and share this information with you. We're working to build a national model that can be replicated in other states. Today, we are only working in South Carolina and North Carolina. That means we're supporting about 2,100 families. That's enough for us, but we're hoping to build this model that can be replicated in other states. I appreciate your time. I'm happy to answer any questions.
Thank you, Mr. Daniels. Any questions from council?
Yeah, Mr. Daniels, what is the survival rate now? If you know, if you don't, that's fine. What's the survival rate now compared to 20, 25 years ago?
About 20% of children will not survive 5 years. One of the real challenges is only about 4% of all cancer research is being directed towards pediatric cancer. To give you an idea of what that means, in the last 20 years, doctors have come up with 72 new treatments for adult oncology. In that same period of time, there have been 4 for children. So while the survivor rate is increasing, it is far lagging behind adult cancer.
The lack of care, especially in our rural communities and counties, is that attributed to a higher mortality rate because of lack of service or access to the service?
It's attributed to the fact that it's so much harder for low-income families, single-parent families, to adhere to the very rigorous treatment schedule that most cancers require, given the distance to that hospital. And you can imagine if you live here and you're driving an hour each way to NUSC, that's probably a half a day away from work. Assuming you can get time off for work. It's the distance to getting that care that really is the major contributor. And that's why we think it's so important to make sure that the cost of that transportation is not the limiting factor.
I've got a question. How do you find the revenue to take care of your budget requirements?
We're 100% philanthropy.
100%? What was that? 100% what?
Philanthropy.
Okay.
It's all family foundation support, individual donors, corporate support. We get no government reimbursements at all.
Yeah, because I haven't seen any advertisement on any of the media or anything for you all. I'm surprised that.
No money in the budget for advertising.
Okay. What's your annual budget?
This year is 3.1 million.
Thank you.
Mr. Daniel, one other question. When a parent has to miss 3-4 a week's work, do you guys replace that lost revenue for that family or just for the travel and meals and hotel?
We don't replace income, but we will make sure that the lack of income doesn't keep that child from getting where they need to go. So we do step in and help with utilities. We'll help with rent payments. We've helped stop repossessions of cars. You know, the things that happen when you lose income are the things that we'll step in and help with.
Okay, thank you.
Mr. Daniel, what's the criteria for a family to qualify for your help, or is it open to everybody?
It's open to everybody. We have no income restrictions. As long as we get a referral from the hospital, we're going to support that family. What we have found over time is that families that are well-resourced will typically say, no, thank you. So most of our money gets distributed to our lower-income families, but that's the family's choice. We're there to support them however they need it.
Okay, thank you.
Any other comments for Mr. Daniel? Okay, thank you. And thank you for all you do for the children of South Carolina. Really appreciate you.
Thank you very much.
We'll move down to our presentation from Georgetown County Alcohol and Drug Abuse Commission. I got to Mr. Carr.
Yes, sir. Good evening, everyone. My name is Raphael Carr, that's C-A-R-R, and I'm the Executive Director for the Georgetown Alcohol and Drug Abuse Commission. It's good to be back, and I know I call it fall, we were here and we were able to share some things. I presented you a PowerPoint at that time, so I've just kind of updated some things and just to kind of provide you an update on how things are moving for our organization. And with me tonight, I've got the support of two of my board members. Go back, I'm sorry. Since the last time, you all have come through for us and ensured that all of our board seats are filled. And so you can see the list of your appointments there. Our staff, we are still short like 2 vacancies, but for the most part, we are almost fully staffed, which is a great thing for our organization. And then I updated you guys with our income. I presented a draft budget, because usually when it comes to our funding source through DEOTUS, a lot of times it's not until we begin the operating in the fiscal year that we get the actual dollar, or I guess the real dollar amounts that we will be having access to. And then also there's some additional dollars that came through, mainly through the South Carolina Opioid Recovery Funds that I'll reference. That's actually altered our pie chart a little bit. So I updated that pie chart. And so as you can see in there, our federal block grant increased by from 27 to 28%. In some of the other areas, we've seen kind of little drops, but for the most part, our funding has been stable. I did list the SCORF dollars, and that gave 12% increase, which is newly acquired funds. And that's from the county's source, and we also are kind of waiting to actually tap into some of the funds that the city has allocated. Next slide. And so kind of how are they budgeted? So for the income that we do receive, this is kind of where it goes to. And as you can see, a great deal of our dollars goes to our personnel and our fringe. We're not state employees. We are a nonprofit organization. We are able to participate in the state PEBA program. And so, with those costs, that's what covers all our full-time employees. And so we have to pay our employer portion of it. And most of the clinical staff, or I should say all the clinical staff that we have are master's level counselors. And then we've got a good group of our staff that have been there for a long time. And then with the client care, that's actually money that goes into what it takes to actually, I guess you could say, some of the funds that we get are earmarked to help them with their actual, cost of services. Because what we have to do is we have to charge across the board, but for those who are indigent, then we're able to use some of those federal block grant dollars to cover the cost of their services. So that goes as a client service cost. And then we just got our general operations, that's keeping the lights on, keeping the building updated, because those are things that kind of we run through our own budget. Next slide. And so kind of we do have the county appropriations, and back in September, I told you how that was used within our organization, and there really hadn't been any change in that amount. So you'll see in the orange, that's kind of the 2 programs that we primarily use. And ADSAP, because pretty much all the clients have to pay their own ADSAP fees. And so whatever little admin costs that it takes, we'll use the county, appropriated money to do that with. And the ADSAP program is when someone loses their license or gets a DUI and they want to get their license back. That's the program that they have to go through. It's mostly education, and it's evidence-based education curricula that they will go through in order to do that. And then for our outpatient services, that's for the group counseling that someone participates in, or the individual counseling that they get, or even the peer support services that they'll get. And as you can see, a large part of the support from that comes from our federal block grant dollars, and then we do use some of the county appropriated funds. Next slide. And so I wanted to update you to kind of where we're seeing the majority of people coming into us from. So from that slide, who we're serving, the demographic, I guess you could say the program that and this is something that's been common. Our outpatient program is the one that we see most of our persons or residents come through. The next biggest one is that ADSAP, which is once again the DUI curricula or the program. That's what they will come through. And then our MAT, and that's medicated assisted treatment. So for those people who are falling into the I guess you could say the rat race of opioid addiction, medicated assisted treatment is the growing preferable treatment modality to use with that population. And so with that, that's where we're seeing the third biggest group come in at. Next slide. And so when we look at the population of who's coming in, one of the things that's happened is it's actually trended. I think from the last time we were having more males coming in, or more female, more females coming in, and we're now seeing that grow a little bit, or that actually reduce a little bit, and so that male population is a little bit higher than the female population is now. And you can take, under 12, we don't really see those because most of those are kids. And so with the school resources that they have, they really haven't developed a problem that's large enough for the school to refer them out yet. So the school counselors will usually manage those. And so, the biggest age group for us is that 30 to 64, that working population. And me and Mr. Barber, our board member, were kind of talking about that and kind of the surprise of, kind of that 18 to 29, thinking that group might be a bit larger. But those are the ones that are usually in denial. And then there's also a large segment of them that will kind of go to the self-help groups that exist before they decide to come into an institution or, a formal organization for services. Next slide. So I wanted to share with you a little bit about what we're doing with harm reduction efforts. And I'm a little disappointed at where we're at right now, but there's a reason for that. So we are distributing Narcan out into our clients and into the community, fentanyl test strips as well, which is what they will use, that if they are using and they have a drug, if they want to make sure that that drug does not have fentanyl in it, that's a test kit that they can use. And we do have those and we do give those out. And then we're also doing that with xylazine now. Xylazine is one of the newer substances that we're seeing ravage our communities. And so we began doing the xylazine strips about 3 months ago, which is why that number is just so small and it's still unfamiliar to a lot of people. But we're also doing this I guess you could say prior to this fiscal year, we were using our MAT coordinator position to kind of coordinate most of this and actually do most of this work. And that's a position that's actually been vacant since October. So what we've had is we've had some of our other clinical staff and our prevention person kind of working together to get that much out. So we're still kind of, I guess, making some ground and doing some even with the vacant position. Next slide. And then our prevention activities. And so we've got one prevention person that covers the entire county. And so I just took a snapshot of some of the activities that he's been successful in so far this year. And to be honest with you, there's probably about 15 different objectives that he is working on at any one given time. Some of those, and the only real help he has with some of those is with our alcohol enforcement team. And and we actually share that with Horry County because that is a judicial circuit position. And so they'll spend probably about 70% of their time in Horry County, about 30% of their time working in Georgetown County, and they work with our prevention specialists to deliver the stuff related to underage drinking. And also they kind of focus on DUI a bit as well. All right, next slide. And it looks like I left off my C, so I apologize for that, but this is our school opioid recovery funds. And so we partnered with Tidelands Health to utilize the county pot of funding that's available, or a portion of it. And so what we're doing with that is we were able to place peer recovery coaches in the Tidelands Georgetown Hospital. And we actually had another grant from MUSC that had 3 positions. And what we were able to do is we were able to add a peer coordinator and put 2 more positions in so that we could get up to 24-hour coverage. One of those positions just became vacant, and so we're working on filling that so that we can get back up to 24-hour coverage. And we're working on a plan to kind of do some carryover funding and to keep that going so that we'll always be able to catch those people who are dealing with the opioid abuse and overdose. We can catch them at the hospital, because with that project, it's about catching them in the ER. If the ER physician decides to start them on their MAT, then they come to our office the very next day, and our medical professional that we contract with will go ahead and continue them on, and we get them into counseling services as well. And then with the city wanted their plan to focus on prevention activities. So we're in the stages of wrapping up that proposal to be able to get that in within the next 10 to 15 days. And that's going to support some of the community-based efforts that we have, such as the Open a Door, which is focused on stigma. We created a WASP coalition, which is When Y'all Health and Safety Partnership, to where we'll have a number of various partners that we're working with that will be doing a lot of health promotion type activities. And then they'll also kind of be, in doing the health promotion, they'll also be able to help us get out some of the, Narcan and fentanyl test strips and things of that nature. Next slide. And then last, I just wanted to kind of give you an update on the state restructuring, because I'm sure some of you have probably are very familiar with kind of the state's efforts to merge a number of state agencies. So DEODIS is one of those. So DEODIS they provide oversight to us. And so in that plan, that DEODIS will become a part of that larger state structure. What we expect is that we, as the local commission, you guys appoint our boards. We are a board of Georgetown County. We should see very little impact from that as far as the way that we're able to operate. Now, the funding stream is something that could be impacted, but as of right now, there's no foreseen changes for the next fiscal year. And in the House bill, it does keep everything really the same. The Senate bill does, I guess they're looking at a different pathway to deliver the alcohol excise tax money. But we still believe that that's still going to get to Georgetown County for us to use to continue to provide services. So I'm sorry it took too long, but I appreciate you guys listening to me. And if you have any questions for me, I'd be more than happy to try and answer them.
A question. Thank you very much for all you've done and are doing. Regarding the opioid lawsuit, how was that distribution? Did it come down part to the county or part to the city, and how much trickles down to your agency?
Okay, so it went to, I guess, at the state level, it went to the Attorney General, and the Attorney General, they created this corp board, and so each municipality that was listed received some. So or Georgetown County has a pot of funding. The city of Georgetown has a pot of funding. And I know that there's a number of projects that the county has done, and we're just one of those. Us and our partnership with Thailand, we're just one of the projects. And so with that, for this first year, there was about $300,000 that came into that. And we didn't spend it all down because it came in July, and we didn't really get things going until October. So we're looking to submit for continued funding to be able to draw that down. And then we're going to also plan to put a new proposal in at the end of the year to continue what we're working on. And pretty much the same thing with the city. So they each have separate pots of money. And from my understanding, as the settlements continue to come in, there will be smaller amounts that will add into that every year. And so our project should be able to continue to draw down for as long as there's money in those pots.
Very good. Thank you.
Mr. Carr, just a couple of questions.
Yes, sir.
One, are you guys able to track your success rate once treatment has begun? Or is it just, I would think it would be very hard of losing contact with patients, individuals.
We are able to do some tracking, and we do lose a lot of contact. When we talk about success, there's various measures of success. So the first level of success is did they successfully complete their treatment program, however long that may have taken. And then once they're discharged, then kind of did they remain employed. So that's harder for us to track, because a lot of times once they leave services, they're not always willing to answer our call, but we do have measures in place to try and collect that information.
Another question, and we spoke of this in the fall, I think it was, when you were here. Transportation from the outlying areas to your facility here in Georgetown, in the city. Have we got something together for transportation, or is that still a problem? I know it once was.
It's still an obstacle, and it's probably going to continue to be an obstacle. But right now, we receive a pot of funding through Health and Human Services, and so we've designated most of that to be able to use gas cards. So we're providing gas cards with that, and then with the project with the hospital, we just now started working with I can't think of the name of the taxi company right now, that we are looking at probably expanding to more of our services. But right now, we're kind of relying on the use of our gas cards and the kindness of family and friends. I guess that's probably the most cost-effective measure.
Well, one other, are you contacted by the individual with the problem, or is it generally by a family member that brings them in? How was your first contact other than the hospital? And a follow-up with that would also be, do you have any dealings with the inmates out at the county jail? Because it's a large majority of them have substance abuse problem is the reason that they're in there.
Well, we just met with Officer McGann, and so we're just now starting to put one of our peer supports over there, and there are some other programs that are already over there. But we're going to start working, I guess, they went to the training last week, so probably, I think next week is when they're going to start providing services there. And if I go back to, you asked about the, just draw a blank. What was the first question?
Well, how the initial contact is made. Is it the individual or a family member, or?
They have to voluntarily come in, so before we can actually open, admit them, the individual has to come in to do the admission. But many times we will get calls from a family member, and so we're able to communicate with that family member. We've got our counselors will talk with them, peers will counsel them, give them kind of pathways of how to access service. But since they were like a judicial referral or something, or unless DSS, some other entity, kind of refers them in, it's going to be a self-referral process.
One other question, and I'll end it. Can you do the counseling? And I see where a lot of people would not want to come into the site for the stigma attached to that. Can you do counseling at home or at other places, or does it have to be at your location, or how does that work?
It's usually in-house, because that's one of the best ways that we can actually maintain confidentiality. But of course, during COVID, we did have to resort to telehealth. And so we do have a few mechanisms of telehealth, and we will use it, I guess, when it's applicable, but preferably our clinicians would like to get the person in front of them as much as possible.
Thank you so much. Appreciate all that you guys do.
Any other comments or questions from council? Okay. Mr. Carr, again, thank you and your board members for being here this evening. I just have one question, really. I'm kind of concerned if following your evaluation and your counseling of a particular person, if you realize that they may need long-term care, inpatient treatment, what happens at that point?
At that point, we then start reaching out to the facilities that are nearby. Which, I mean, we've got Florence, we've got Charleston Center, and then Sumter has an inpatient facility, and so those are the three closest. There's a facility in Columbia, so at that point, we're now trying to reach them to try and get them into places. The Salvation Army also has a network, though most of those inpatients are in North Carolina, but they will also help with transportation to get there. So we rely on them as a partner as well to actually try and access some of the inpatient facilities that are there. But, that's what our counselors do. They will work with the referral, help line up the transportation to get them there.
Okay, so if a family realizes that their loved one may need some type of long-term care, they can contact you
Yes.
to get some referral to an inpatient facility?
Yes.
Or contact your agency, I should say.
Yeah, we work with them, and if they are, I guess if it's after hours, they can call our peer coordinators that are over at the hospital, because that's one of the things that they do. In their downtime, when it's not an actual person in the ER, they're continuing to build that list of resources and relationships with those resources.
Okay, all right, thank you. Again, thank you and your board for being here this evening, and thank you for all you do for Georgetown County. Appreciate you. Okay, we'll move on down to public comments. A public comment period is included on each meeting agenda and shall be limited to 30 minutes. Each speaker will be limited to no more than 3 minutes. No speaker may yield his/her allotted time to another speaker. Members of the public who wish to address council during the public input period should sign up with the clerk of council before the meeting is called to order. And please note that we do have a timer on the screen for you to abide by, so when the timer expires, we ask you to conclude your comments. And also note that we will not be able to respond to your comments after you have made them. Madam Clerk, do we have any speakers for this evening?
No, sir.
No speakers.
No speakers.
Okay. Well, with that being said, then the public comment is closed. We move on down our agenda there are 2 matters on the consent agenda which were previously approved by virtue of the agenda approval process. That's procurement number 23-037, the rebid for the hangar taxi lane improvements and hangar site work at Georgetown County Airport, and also procurement number 24-018, fiscal year 24 municipal lease purchase financeable vehicles and heavy equipment. We'll move to our resolutions and proclamations. Proclamation number 24-08, to proclaim April 20th, 2024 as Antoine Maybank Day in Georgetown County. Ms. Akers.
Council members, before you is a proclamation, as you said, to declare the 20th of April as Antoine Maybank Day. This is something that we've been doing for the past 3 years since we named the track field at Beck Recreation Center in honor of Mr. Maybank, who, as you know, is an Olympic gold medalist and a Georgetown native. On the 20th, he will be joining us again for a day of family fun and festivities. We're still working on the schedule for that, but we'll be putting out some information on that soon. Mr. Maybank is going to be a guest star on our podcast for April, and he is also going to be, I believe, the MC for our Senior Olympics that will be happening on the 19th of April. So we have a lot going on there, and we would ask you to please approve this proclamation.
Thank you. Any questions from council? If not, is there a motion pertaining to proclamation number 24-08?
Mr. Chairman, I move for adoption of proclamation number 24-08.
It's been moved by Councilor Johnson for adoption of proclamation number 24-08. Is there a second?
Second.
Second by Councilor Carolina. Any discussion? All in favor, please raise your hand. Opposed? Motion carries. Thank you. We'll move down to resolution number 24-09, in recognition and celebration of National County Government Month. Ms. Akers.
This is another annual event for us. April is National County Government Month, and NACO asks counties around the United States to join them in celebrating. So we would like to ask you to proclaim April as as County Government Month in Georgetown County. Part of the goal of this is to highlight all the work and the services that are offered by counties. So we will be having a number of events throughout the month. There's going to be an open house at the airport. Midway Fire Rescue will be doing a smoke detector blitz to install them around homes. And we will, of course, be having our second annual Taxpayer Academy. I would invite you guys to drop by any Thursday in April and see our latest class as they learn about all that Georgetown County government does. So we would request that you please approve this in recognition to celebrate National County Government Month and counties, well, to celebrate Georgetown County Government Month.
Okay, thank you. Any questions from council? Is there a motion pertaining to resolution number 24-09?
Mr. Chairman, I make a motion, we approve resolution number 24-09.
We have a motion by Councilor Newton for adoption of resolution number 24-09. Is there a second?
Second.
Second by Councilor Johnson. Any discussion? All in favor, please raise your hand. Opposed? Motion carries. We move on down to appointments to boards and commissions. In your packet is an application from Mr. Jefferson Lennon to fill the unexpired term of service on Georgetown County Planning Commission. I hereby move for Jefferson Lennon to be appointed to Georgetown County Planning Commission. Is there a second?
Second.
Second by Council McConnell. Any discussion? All in favor, please raise your hand. Opposed? Motion carries. We'll move down to our first reading of ordinances. Ordinance number 24-07. And again, the first reading of ordinance will be read into the record by title only. Ordinance number 24-07, an ordinance to enact fund balance management policies. We move down to approval of minutes. Is there a motion for approval, adoption of our council meeting minutes of March 12, 2024?
So moved.
Moved by Councilor Carolina. Is there a second?
Second.
Second by Councilor Johnson. Any discussion? All in favor of the adoption of the minutes, please raise your hand. Opposed? All right, motion carries. Any further business to come before council pursuant to the agenda? Seeing none, is there a motion to adjourn?
I move.
It's moved by all council members to adjourn. Is there a second?
Second.
Second by all council members. Any discussion? Meeting is now adjourned.